Excellent. So Dr. Jimenez-Salazar is going to be talking about motivational interviewing, a really setting tool. Can you go to the next slide, please? Our disclosures. So we are CalMAP, formerly CAP. This is some information about our funders to whom we are grateful. Next, please. Okay, I will turn it over to you. Thank you so much.
Terrific. Thanks so much for that introduction, Lindsay. And it's awesome to be here. I'm excited to present today on motivational interviewing and the use of these skills with adolescents and their caregivers. It's a clinical tool that's really helped me in terms of guiding conversations and motivating young people towards change. So our learning objectives for today is to deepen an understanding of the spirit of motivational interviewing, to be able to identify change versus sane talk, so differentiating the two, to identify two types of reflections. So within the specific skills of MI, what are two types of reflections? And to be able to change closed-ended questions to open-ended questions, identify stages of change with students and caregivers, and to use at least one OR skill. So my goal for today is, as we wrap up this session, that you feel this sense of confidence and competency to use an OR skill in your conversations with your clients. So let's start just by chatting about what is motivational interviewing. And I imagine that for many of you, this is something that you've heard before. In thinking of various styles of interventions, we can think of both directive or directing in a conversation, as well as following, right? So taking more of a passive listening approach to a conversation. And motivational interviewing brings both together, a style that is both directing and following to guide conversation. And I'm going to play this video so that we can hear Dr. William Miller, who is one of the co-developers of MI, describe MI in more detail.
I'm not able to hear it.
Did I hear you're not able to hear that?
Yeah.
Let me quickly share screen again. It might be that.
It's always tricky.
What is motivational interviewing? I mean, it's a way of having a conversation about change. And it's a particular way about having a conversation about change that listens to and calls forth the person's own ideas about whether to do that and why to do it.
One of the fastest ways that you can burn out as a therapist is being convinced that your job is to tell people to change when they're convinced not to. That's a recipe for burnout. And that is, in motivational interviewing, explicitly what you are not doing.
Why don't people change is one hell of a question. It's perhaps a useful question, but there's no single simple answer to it.
One of the things that Steve Rolnick helped me to realize was how normal ambivalence is when you're looking at a change. And to simultaneously want and not want something is perfectly normal.
You're on mute, Maria.
Let me see. I'm not sure what just happened where I was muted while sharing the screen, and then let me try. Sorry for the tech.
Sometimes it gets funky with multiple things you're trying to share. Take your time.
Let's see. Okay. Am I? Can you hear me now? Yeah.
Can you minimize? We can see your Zoom window. It's blocking the slide.
Okay.
Maybe if you shared. Oh, that's perfect. Yeah.
Okay.
Thanks so much.
So bringing it a bit of what we just heard in the video back to our discussion, right? So MI is guiding a conversation for folks both to describe the change that they want to make in their lives and to do so in their own way and their own terms. So generally speaking, I'm going to just describe some of the principles of motivational interviewing. It's both creating a space where folks can express themselves and for us to express empathy in hearing how things are going in their lives, the changes that they want to make based on the difficulties, the problems that they see. It's both creating a discrepancy or developing a discrepancy between the things that they are currently doing, how things are at present, and what they see in terms of the life that they want to have, right? How they want to carry their lives, how they want to show up in their day-to-day. So creating this discrepancies to create more of an awareness of what might be some problem areas and specific changes that they want to make. In MI, we also roll with resistance. As humans, right, it's normal to have some ambivalence, to change, some resistance. We go back to our own ways. We are comfortable sometimes with how things are. And so we roll with resistance. It's a dance, right? It's not telling people what to do or that writing reflex. It's a dance, rolling with resistance. Ultimately, it's about supporting self-efficacy, building motivation, and our clients' belief in themselves that they can affect change and, navigate situations, take their day-to-day, in the ways that they want to show up across various areas of life. And through MI, we also amplify ambivalence to help, again, raise that awareness of there's this ambivalence, so I need to make a decision ultimately and move in one direction that is aligned with my values and making those changes to my behavior, like creating that self-efficacy of you can move in that direction through your own behavior. So bringing it more specifically to MI with adolescents, I'm positive that in your work with teens and with their caregivers, you may have heard, it just seems like they don't want to listen, or they're not, like, I'm asking them to do something and it's like they're not necessarily tuned into the conversation, right? Or maybe it's like they're doing things that at times raise concern for both providers and their caregivers around their safety. And so I wanted to both normalize that in adolescent development, we anticipate and we encourage young people to explore, right? To have more of a increased autonomy, a sense of their own decisions, and that they're going to test boundaries and observe what happens. And for this reason, MI can be a really effective tool in terms of maximizing their sense of autonomy, their voice, their choice, really creating a partnership with teens where they're talking themselves into doing what's important to them, and for them to name the behaviors that they want to change, how they, and in their own terms, right? So it's super common, right, when we ask a teen to do something that they might just say like, well, no, I don't really want to do that, right? So through MI, they're making their own choice to change, and ultimately for raising their voice, choice, and autonomy. I want to describe a bit more the spirit of MI. So the spirit of MI is the how, right? So how do we approach having these conversations? And at its core, we're doing so through partnership, right? We're partnering through building rapport, through expressing empathy. It's also through acceptance, right? Really accepting that ultimately change is up to the client. We're not telling them what to do. They have autonomy to make their own choices, and we embrace that. We want them, right, to make their own choices. It's through compassion, really holding an empathic and supportive response, both in hearing about challenges and the problems that clients share with us that they see are going on in their lives, and holding compassion for the possibility that, right, change might be going in one direction and our clients may change course, right? Or they may share that maybe something's showing that they're maybe having some ambivalence, right? And so holding compassion for that dance, that twist and turn. And ultimately, it's about evoking change, right? So the client wants to make this change. It's kind of helping clients talk about the changes that they want to make. And if that's the how, I also want to present some of the what. And so the ORs are the key or core engaging skills of motivational interviewing. I hope the sound works this time. Please let me know if it doesn't. We're going to hear more about the OR skills.
Not able to hear. Thank you, Maria, for rolling with the challenges of Zoom audio.
Let's start by learning an acronym that we use to describe these very concrete, engaging skills. ORS. So what does the acronym ORS represent? ORS stands for open-ended questions, affirmations, reflections, and summaries. These are the basic engaging skills in motivational interviewing. O stands for open-ended questions, and we contrast open-ended questions with closed questions. Closed questions, the answer is yes or no. Open questions have the value of helping clients to explore their own thoughts, experiences, and feelings in greater detail. A stands for affirmation. An affirmation is really nothing more than you noticing something positive about your client and bringing that forward in an explicit fashion. R stands for reflection. Here we're talking about reflective listening or active listening. You're offering a guess about what the client has had to say to you, but you're offering that guess as a statement and not a question. S stands for summary. And summary is really nothing more than you taking an opportunity in the course of your conversation with your client to let them know that you've been following, you've been listening, you've been tracking, by offering them a brief summary of what they've had to say to you so far.
You muted.
How about now? Am I still muted?
We hear you.
Okay, cool. Today we're going to practice some of the OR skills, and we'll do so through a case example. So imagine that you're meeting with your client, Chris. He's a 15-year-old who recently established care with you. And through an intake assessment, you learned from Chris that his school attendance has become a main source of conflict.
Maria, we can't see your slides. I don't know if you mean for us to right now.
Okay, I'm so sorry for these technical.
It's not you, it's Zoom.
Let's see. Can you see?
Yes, perfect. Thank you.
Oh, great. All right. So you've met Chris, he's 15 years old, and you've learned that he's having a tough time with his school attendance. And it's become a main source of conflict with his dad. And what you gather is that Chris likes to stay up late playing video games with his friends. He shares that this is when everyone can go online and talk. His father expresses concern that Chris does not seem to care about his grades like he used to. He's arriving at school persistently late, sometimes missing his first and second period classes entirely. And Dad tells you that whenever he broaches the topic, Chris becomes visibly frustrated, shuts down the conversation, and tells him, Dad, that he's the only one who has a problem with his attendance. So let's use an OR skill to learn a bit more about what's going on for Chris. So now imagine that you're meeting with him and you're having a conversation, and he states, it's like my dad just doesn't get being a teen. He is on me about this nonstop. It's not a big deal at all. So take a moment to type a simple reflection in the chat. And just as a reminder, simple reflections are repeating exactly what your client said, perhaps rephrasing it just in very similar words. So type a simple reflection in the chat, and when I say go, let's share it. All right, let's see what folks came up with for a simple reflection. Awesome. Yeah. Exactly, right? I'm seeing some great examples of rephrasing, and in some cases, like repeating exactly what the client has just said. Yep, it sounds like your dad doesn't get you. You feel like your dad is on your case all the time, and it doesn't get being a teen. Your dad doesn't understand being a teenager, and he's always hassling you about missing school. Great. And so now let's practice using a complex reflection. So you continue your conversation with Chris, and he replies, yeah, I get my work done in advisory so I can have more time to do what I want after school. So this time, let's practice using a complex reflection. So again, type a complex reflection in the chat, and when I say go, we'll share. All right, let's go ahead and share a complex reflection of this statement. Oh, this is terrific. I'm seeing exactly like a rephrase of what Chris has said, right? It sounds like you're thinking about time management so you can meet your obligations. Really emphasizing that behavior and by rephrasing. It sounds like you're being really proactive to get your work done so you can have more free time, and you feel like that's going well. So in that sense, both highlighting what you've heard the client describe, and then similarly adding something that you perhaps interpret is happening. And through making these statements, and I just want to highlight in reflections, we really want to share these as statements rather than questions. So in making these statements and through complex reflection, adding a layer of interpretation, it creates an opportunity for clients to expand on what they've said, as well as to offer corrections, right? Like it's part of a conversation that we may reflect back, and they may say like, actually, that's not quite it, or let me share a bit more. And so in that sense, we're guiding the conversation, both for the client to hear from a different perspective what they've just shared, and then to having an opportunity either to expand upon that or to offer a correction. And that brings us to summary. So summary brings together information that you've gathered. And through our conversation with clients, we may pause at times when we've both been using open-ended questions and have gathered more information. And through reflections, we hear that they're elaborating on points. And it's an opportunity to take a pause and share a summary of everything that you've heard to that point. And again, it's an invitation for clients to offer correction, to elaborate upon something. So bringing it back to our example with Chris, this is something that we might say as we've gathered more about what's going on in conversation with him, and maybe we have some information that dad had shared previously. So here's just an example. I'm going to summarize some of what I've heard. Feel free to correct me and let me know anything I've missed. Your dad is concerned about you missing classes. You're a great student, and he's surprised seeing that you're getting to school late. It's tough waking up early. Playing video games brings you and your friends together, and you don't want to miss out on that. It's the only time you and your friends get to talk. Your dad keeps bringing this up, and this has you feeling frustrated. You're doing your best to make up missed work from class. If only there was a way to get to school on time and get to talk to with your friends. Before I elaborate just a little bit on key changes on key points about change and the stages of change, does anybody have questions or anything that they'd like to share about the case example that we just saw? Okay, so a few key points about change. Change is difficult, right? And it's not always comfortable, and it's easier to stay the same, and we tend to go back to our old ways. That's that ambivalence that we all experience in making changes. We know that it requires creativity, having an open mind, and developing and having that emotional and cognitive competencies. It includes emotional and cognitive components as well, in the sense that making changes can, right, elicit, kind of create feelings, bring things up for us. And so it's important to create space where we can talk about that with our clients, about what's coming up. And sometimes it may be the case that we notice that our clients are perhaps trapped by ambivalence, right? That sense of, I see the importance in making this change, and also kind of feel a pull to stay where I feel comfortable or doing the things that I see serve a function, right? There's probably a function to why they're doing those things. And so in just normalizing ambivalence, I think it's helpful to really think of change happening over time, and the fact that it's not a linear process. And moving across the stages of change is just as important as the result, right? So that process of identifying change, planning it, going through those stages is just as important as the result. And there's often a difference between what someone knows that they should do and their readiness to do it. And we're going to get a bit more into that through the stages of change. So in using motivational interviewing, we are ultimately helping clients move through the stages of change. And we're starting here up at the top, where clients are in pre-contemplation. Perhaps they're not even aware of how behavior is getting in the way of their day-to-day. And so we start there. We start with using our motivational interviewing skills to deepen awareness of behavior. And as clients deepen their awareness of behavior, they may start describing, right, through conversation, problems that they see, the things that maybe aren't aligned with how they want to show up at school, at home, across different areas of life. And it's totally normal that in this contemplation stage, there's quite a bit of ambivalence. Like, they're still not quite ready to take action. They're starting to see there's a problem. And so we use MI skills at this stage really to focus on, well, what are some specific areas of behavior change that you want to make? And how are these aligned with your values? Ultimately, that helps build motivation to then move into preparation, right? To start making decisions to change, to commit to action. And through all these stages, but particularly to help us notice whether a client is in contemplation, in preparation, or actually entering the action stage, we're listening for change talk. How are they talking about the changes that they want to make? How are they talking about their commitment to do so? And are we hearing some specific words that really describe how they would make this change, or the steps that they would take. Once there's commitment, that's when our clients are entering that action stage, right? And so we're guiding the conversation really to talk more so about what are the plans, what are you doing to affect that change, and as much as possible, distilling that into smaller steps to make it actionable, to make it right within something that our clients can start and sustain. And with that, I just wanted to give a quick overview of how we can listen for change talk. We can use the acronym DARN CAT, right? So things that we're listening for in our conversations with clients as they're talking about behavior change. We're listening for I want, I wish, I prefer to, right? That really denotes commitment and how it's aligning with their values. That sense of self-efficacy, and really anytime that we hear self-efficacy, like can, I could, it's possible, we really want to affirm that. And we're also listening for that reason, right? Like, why is it important? Not based on what we see, not based on maybe what caregivers have shared, but why is it important to them, for this young person? And similarly, like related to that is this component of need, right? How is it important? Are they seeing that it's something they must do? Is it something that ultimately they see relevant and aligned with how they want to show up across areas of life? Commitment is once we start to really hear those action words of I will, I'm going to. And then activating is that discussion around, okay, here are the specific steps, how I'm preparing, the goals that I'm setting to affect this change. And as they enter into the action stage, really taking those steps, putting that plan into action. So in the case example, just based on how early it is in our relationship with Chris and some of like that, initial learning about what's going on, totally normal that Chris has some ambivalence about changing his bedtime routine. And your conversation helps deepen his awareness of behavior, right? Staying up late is resulting in missed classes and conflict with his dad and decreased energy. So he's feeling tired the next day. And I invite you now to share what's something that Chris might say that would be in line with change talk. So what's something that we might hear Chris say in line with change talk? Let's go ahead and share in the chat. Awesome. I'm seeing some responses that really describe, right, the recognition, like reason for change, as well as some steps that he might take in terms of, wanting, I want to get my grades up, that I want, or the recognition of, well, I could get to bed earlier. Feel bad, right? Like his reason for change. So I feel bad about missed classes, describing that he's feeling anxious about walking late into school. Terrific. You got it. Those are all statements in line with change talk. Here are a few examples. I can try getting to bed a bit earlier. I guess I do stay up late sometimes. I want to get to bed around 11:30. It's tough being the first one to leave when my friends and I are having fun. I might have to start doing that. That's all I've prepared for today. I just want to take a moment to thank both Doctors Brittany Bryant and Evan Holloway for sharing content for today's presentation. The CalMap team, so grateful for this opportunity to join you in presenting this didactic. as well as my past clients, mentors, and supervisors. Right. Thanks, everyone. I'm happy to hear questions and share anything else that might be helpful today.